Hi, I'm Carol Kane, and that's Bob Riney. My co-pilot for the entire show today as we talk about everything from healthcare to the new look Health Alliance plan to economic development, the Mackinac conference. Am I leaving anything out?
No shortage of things going on.
Are you ready?
I'm ready.
Let's get started.
From CBS Detroit, this is Michigan Matters with Carol Kane. Michigan Matters is brought to you in part by Cure Auto Insurance.
Bob, you are so intertwined with Henry Ford Health. You were born in a Wyandotte hospital that's now owned by them. You have started as a security guard, worked your way up. You met your wife there. I mean, your story is the Henry Ford Health story. It's been 44 years. Is that a record?
Probably it is, although we have a lot of employees that we celebrate on an annual basis that are in their 50th year, 55th year. So we have incredible loyalty because it's such a great organization.
Will you stick around for 50 till 50?
You know what? I'm having fun now. I'm loving everything that I do. I'm loving the team I get to work with, and we're making a difference. So.
Well, let's talk a little bit about healthcare because that's your world, as they say. You made a big announcement recently with HAP, your insurance arm, which is being rebranded as Health Alliance Plan by Henry Ford Health. So this is a relationship that also goes back 40 years when they started doing things together. Why, after 40 years, rebrand?
You know, we wanted to rebrand because we felt it was time to really proclaim our belief, and that's that health insurance and provider systems working intimately together to coordinate care and have the most effective processes is the best way to ensure health of our members and to ensure affordability. And while we've always been doing that, we have had a lot of success, but it doesn't get known by the name.
Yeah.
So we wanted to make sure that the community knew that we were intertwined. We work and accept other networks, of course, of other physician providers and other systems. But for us, the sweet spot is working the intersect all on behalf of our members.
And the question anybody with HAP is going to be asking right now, this doesn't do anything to my insurance, does it?
No, it does not, and it doesn't require any changes in your network. It's really a way to telegraph that we are about your health, and Henry Ford and Health Alliance Plan should be looked at as one enterprise devoted to you.
How big is HAP, and how big is Henry Ford Health?
So Henry Ford Health, we're a $13 billion company. We have 51,000 of the most amazing team members. HAP represents, or Health Alliance Plan represents about a third of that. We have just over 500,000 members and experienced 40,000 new Medicare Advantage members last year alone, so we're growing.
It's a huge business here. The hospital, Henry Ford, was started obviously by Henry Ford over 100 years ago. I don't know the exact
113.
year. 113, lucky 113. Looking at what's going on in healthcare today, your costs are skyrocketing as a healthcare provider. Customers are paying more than they've ever paid for healthcare and also for their medical needs. It just seems like the costs are going up, up, up. Is there one thing that could help alleviate that, both for you and for customers, to short of nationalizing healthcare? I mean...
Yeah, you know, it's a complex issue. One of the things that we have to do with this state, and I'm really glad that there's a really focused effort now, is we have to grow the population because we have an aging population, and an aging population consumes a lot of healthcare. So we need to balance that bell-shaped curve and getting more young people to stay and come here. But putting that aside, specifically for our industry, it's about coordination of care.
Yeah.
And when people just sort of get isolated care when they think they need it, it's not going to be the most cost effective because it's reactionary versus preventative.
How you juggle preventative care, providing it to people who need it most, maybe who don't have the money to go to their doctor, afford to go to their doctor regularly, their dentist or what have you, who end up when they need help going to ER, which is the most astronomical cost place to do this. How do you address that? And I know this equity in health is really important to you.
Yeah, we are approaching it through what we're calling high-value care, which means that if you as an individual partner with us and you agree to have a primary care physician as your kind of coach, your quarterback, and you stay within a network as long as those services can be provided in the highest quality, then we're going to make sure that you're getting your care right place, right time, right reason, and that we're helping you get your health upstream. You know, when you're really not in an acute phase. And we've been proving that we can reduce the costs that way.
You are located physically, the headquarters is in Detroit, which has a high percentage of African Americans. We know that people of color historically have higher incidence of being obese, diabetes, heart disease, and other things like that, which are more pronounced. And getting the word out about this in a proactive way, goes beyond just the Henry Ford story. This is, the medical community here in our region. How do you think we're doing at helping to raise the bar, getting that message?
I think all of our healthcare systems are working really hard to raise that message, raise the bar. I think that, we talk a lot about social determinants of health because health is impacted certainly by what we do within our walls. But you know what? If you were refusing an admission to a hospital even though you need it because you have a pet at home and there's no one that can take care of that pet, you're going to end up cycling back into the ER in a very, very more complex case. So we actually say, we'll help you solve that. We'll find a community asset that can take care of your pet. It's those small things, if you wrap them around, that help people engage in their own health.
And I know there's a whole lot more to say, but you know what? We're going to take a little break, and Dr. Anthony Chang of BAMF Health is going to join us as we talk about teaming up in the fight against cancer and other diseases. Don't touch that remote, right? Pleased to welcome Dr. Anthony Chang, CEO of BAMF Health, who's back to talk about something really important. It's great to see you again.
Good to see you too.
Well, you guys have been working together on some really significant development here in Detroit. And Dr. Chang, BAMF Health, which has been involved in the fight against cancer and other diseases, you started in Grand Rapids. For your first expansion, you're here in Detroit. You just broke ground, and you've been talking about this. I think the first time we had you on the show was about 2 years ago. How does this make you feel finally?
It feels great, especially we have great partners when we're moving to Detroit. And at BAMF is from the first beginning is always about trying to serve patients who need it. Our mission is trying to bring these cutting-edge life-saving technologies to every single patient across the nation. But we know we cannot do it by ourselves. This is a brand new field. We still have a lot of things to learn, a lot of things to research, and we cannot find better partners, not only in Detroit, but it's also with a great capability to moving things forward.
Well, you're teaming with Henry Ford Health, obviously, and Bedrock Life Sciences, that whole facility there. What is going to make your center, your facility, so unique?
So we basically this is actually the very first comprehensive advanced diagnostic center put together, and based on what we learned from Grand Rapids, we put a lot of new technology, new design into it, which are allowing us to serve more patients, way more efficient, but still maintain the best quality and the best outcomes. So we're going to put the 2 cyclotrons over there, the most advanced scanners over there, and also top medical teams and research teams over there. So that's very exciting.
And Bob, I know that with Grand Destination, your $3 billion development coming to life, which has a new hospital and the Shirley
Ryan,
there we go. Thank you there. And the Nick Gilbert neurofibromatosis, God, try to say that 3 times, center. You've got some amazing things coming to life there, and you've got all of this being brought in together. What's the vision as you see that, and with what you're doing with BAMF, what's the vision there?
We want to accomplish a couple things. One is we want to have all Southeast Michigan residents have access to the absolute best and newest innovations, newest technologies. We want to combine our research, our innovation, our scientists with incredible companies like BAMF, so 1 + 1 can equal 3 in finding solutions. And we want Detroit to be a destination for complex care that people search various parts of the country for, and we have the clinical talent and we have the research, and now we're building an environment that's going to match that, so we're really excited.
Well, and certainly Dan Gilbert, who's been a force in all of this and being a tremendous champion, making an investment there, has started with some of these investments from having to go other places when he was recovering from his stroke. and ended up bringing the facility here that's coming into life. And same thing with his son Nick, who passed of the terrible genetic disease, having that there, having this world-class breakthrough innovative research being done right here. That's going to be a huge driver too.
It is, and you know, people sometimes forget that healthcare and research are very personal. They're usually motivated by people that have gone through the pain of something that they don't want replicated for others. And you know, Dan Gilbert is an exemplary example of that kind of giving. He's suffered a loss and he's determined to find a cure so that others don't have to suffer that. We need to really applaud people like that.
Anthony, BAMF Health, and your focus originally when you first started, it was aggressive therapy for aggressive form of prostate cancer, correct?
That's correct.
You're now expanding that. You're now expanding that into other forms of cancers and other diseases too, right?
That's exactly right. I mean, at first beginning, like a theranostic radiopharmaceuticals can impact a wide variety of diseases, including all kind of cancer and also neurological disease like Alzheimer's, cardiological disease. We started from the aggressive form, the cancer with no cure at that time. But gradually for the past 3 and 4 years, based on the teamwork we had over there, we have already started to extend the treatment to pancreatic cancer, Alzheimer's disease, and we have a lot of cutting-edge clinical trials on pancreatic cancer, breast cancer, et cetera, et cetera. So we're extremely excited about what we can do for the coming 10, 20 years, especially we have new sites and great partners.
You started in Grand Rapids, and I know we've had, Doug Meyer was on with you last time. He benefited, again, had research, had some, you know, therapy, and was it Germany?
Germany, yes.
Germany, and brought it back here. You are looking now at other diseases here. What do you see for BAMF? Real quickly, what would you like to see them evolve into? Is it having centers like this around the country, or what's the game plan?
Yes, I mean, BAMF is going to be, we see ourselves as a leading team in this kind of special frontier for the medicine. And but we also want to see we are the best partners with all the healthcare workers to bring the most advanced technology to the patient to impact a wide variety of diseases. And for the radiopharmaceuticals, so right over here, I mean, we want to make sure it's accessible, affordable to everybody, and also we can learn the knowledge as fast as possible, and we can implement this newly learned technology into clinical practice. And that's our goal, and that's what we want to dedicate our effort into.
And it really kind of dovetails with what Dan Gilbert said. He said, you know, the research that they're doing with stroke victims and with neurofibromatosis is going to be used for other things too. And that's kind of like what the catalyst you're in.
You know, Detroit put this country on the map in innovation during the Industrial Revolution. I think these partnerships that we're building now are going to put medical innovation and Detroit in the same sentence worldwide.
Very well said. Anthony, I know you have to dash off to a meeting. I really appreciate you being here. I know there's going to be much more to say about all this stuff. We'll have you back another time, so thank you again for being here. And keep it right here. We're going to be speaking of Bedrock. It's CEO Jared Fleisher and Wayne County Executive Warren Evans will be with us as the conversation continues, and we will be talking a little politics. Don't go anywhere. We're back. So is the roundtable, which now includes Jared Fleisher, CEO of Bedrock, Wayne County Executive Warren Evans, as they join Bob and me. We're going to talk a little business, a little politics, and we'll talk about Mackinac. So welcome to the show.
It's great to be here.
Good to be here. For sure.
We were talking earlier about the developments, the medical tourism mecca that's coming to life under Bob's tutelage in Detroit, and Jared, Bedrock, which is involved with all of this, owns 140 buildings in Cleveland and Detroit.
Yes,
your view of this $3 billion development, the grand destination, the hospital, the research centers, hubs, other things that are going to be going at it, how important is that for Detroit?
It's extraordinarily important. You know, I'm very proud of what Bedrock is doing with investing billions of dollars in real estate. You know, rocket companies employing thousands of people. But in the United States, the last 2 years, 77% of all net new jobs are in healthcare.
Yeah.
I cannot overstate the importance of the healthcare economy to the national economy and the Detroit economy, and to have the future of health being built in our new center area brings that economic engine to our city. we have endless gratitude to Bob for that vision and that investment.
And Warren, the BAMF Health, which is down at the old jail site there, finding new life here is something that's going to help. Not, I won't believe the jail and what it does, but this facility is going to help a lot of people.
Oh, absolutely. Amazing change of scenery at that location for sure. But just like Jared said, the jobs of the future are healthcare, and to be an innovator, not just a healthcare provider, I think makes an awful lot of difference. And when you look to try to enhance the region and enhance the county, that's just a huge part.
And we could spend the whole time talking about education, which really is its own show here. But Bob, when it comes to preparing young people for nursing and research and all these other jobs that are going to be created here with all of this, are we doing enough within our community colleges, with our university structures? And do we have the, if you will, the groundwork in place to be able to train folks for this?
Yeah, I'm encouraged with the creativity that we're seeing out of our community colleges and our universities and our business partners of making sure that we're getting people into internships at those important decision points so that not only do they get the education, but they stay in our community and invest in our community. And, you know, with healthcare itself, we've got to make sure people realize that it's not just nurses and doctors, that there are so many roles. And even within the role of nursing, there are so many different elements. And AI and technology and digital, it's all encompassing. And so I think it's just such a rewarding career because at the end of the day, you're helping people and you go home knowing you made a difference.
Yeah. Let's switch gears a little bit here. Let's talk about another development in Detroit. That's the Renaissance Center, which General Motors owns. You folks at Bedrock are working with them and trying to figure out how to rebrand, refigure what it should be. We're trying to get some monies out of Lansing to help subsidize the transformation that needs to take place there. Is there anything new with what is going on at the old Renaissance site?
Well, there's nothing new happening at the site, and that's precisely the point. But we do think that we are in the red zone in getting the transformational brownfield program reauthorized in Lansing. And by the way, that program has now supported 15 major brownfield redevelopment projects all across the state. Yeah. We think in June we should see that finally get reauthorized. And then not only will we bring the Renaissance Center back to life, but the 30 acres of the riverfront next to it that are just empty surface parking lots. Imagine when that is the best waterfront entertainment and mixed-use district in the country with major entertainment anchors, public space, maybe a marina, housing, attracting millions of people a year and providing exactly the kind of environment that young talent that could be anywhere on the coasts or Nashville or Austin, that's where they want to be. That's what we're going to build. And it's going to, I truly think, you know, we look to this city in the next 10, 15 years, the legacy, it's going to be the future of health in New Center, and it's going to be the core that Dan Gilbert is building in the heart of Detroit.
Mr. County Executive, you're in the process of trying to get voters in your county to support a measure on the August primary ballot to end the opt-out communities for regional transit. That's another issue that we talk about year after year after year. Things have improved a little bit, but it still needs more. This opt-out measure, why should people vote for it? What does it do?
We need a regional transit system, and with opt-outs, you have a semi-functional system, but not what it ought to be. And with both of these gentlemen and what they're doing, I think transit is a very important part of getting people to school, to work, getting patients to doctor's offices, getting, you know, it's really bizarre. We do a lot of big talk about being a region. Hopefully we vote that way. Okay. Hopefully.
I know you said you've been having a lot of meetings in all your communities.
Yeah. I mean, and that's really, I think, the most significant difference between it and what we've done before is 43 communities. We've sat down with all of them. We will continue to sit down with them. It's not a one-size-fits-all.
Well, that's a big.
It's key to growth.
Yeah.
And I think we just have to keep really reminding everybody that we have to grow. And we can't grow in drips and drabs. We have to grow significantly in this region and in the state. And transit, we know. And the perception of Aligned Transit is a big issue with where young people choose to
They
go.
mentioned transit and they mentioned culture, arts and culture, things that are really important here. But you know what? We're going to take a little break, come back. We're going to talk about the Mackinac conference and a blockbuster announcement that kind of shook things up there a little bit there. Keep it right here. We're back and talking with Jared Fleisher, Warren Evans, and my sidekick Bob Riney. And Bob, amongst the many titles that you have here, many things that you're doing, many jobs, many philanthropic things you're doing. You're also chairman of the Detroit Regional Chamber's Mackinac Conference Policy Conference, which just wrapped up. In your mind, coming out of that, what's the number one issue before our region?
We have 3 priorities: economic development, population growth, and education reform. And those were front and center on the island.
Which, if you had to pick one, saying that's the most.
I'd take education reform because it's the key to all things.
We're going to talk politics here. So Jared Fleisher, I know you're CEO of Bedrock, and you know, you're a young guy. You're doing things in the community. We know you love the town and everything like that. You ever thought about running for office?
I've never thought about it. I do believe leadership matters. I'm sitting next to the county executive who took over for a county that was in a consent decree and in bad shape, and has led it to have, you know, budget surpluses and to be growing. So I certainly appreciate how much leadership matters. But I also believe that us in the business community and as civic leaders can truly make a difference in the process from these seats. That's what Bob does every day, and that's what I'm trying to do.
So somebody who was in politics, who made a blockbuster announcement a little bit before the conference took place, is Mike Duggan, who decided to withdraw as a independent candidate for governor in the state, which shakes up things as he was drawing from the Democrats and the Republicans. Warren Evans, you Democrat, what do you make of Mike dropping out, and who does that help between those two candidates still left, Jocelyn and...
Well, it certainly helps Jocelyn, and I will say I'm glad it helps Jocelyn. But I don't know. Mike is a brilliant guy. Mike has looked at the numbers, I'm sure, and he's looked at some of the things that are going on and decided that was a wise decision to make, if in fact that's truly it. And this is a pivotal point before Mackinac that you need to either be in or out.
Right, Bob. You also have a podcast called Bobcast, which I know is on Apple and Spotify. What question, if Mike Duggan was standing here, what would be the one question you'd ask him about his decision?
What really took him from all in to making the decision, and what's next?
Okay. So as you look at this, I know Mike was going to be a force on the island, and I think he was going to be one of your leadoff speakers, if I'm not mistaken here. Him stepping aside for the time being, how do you feel about the state of politics in Michigan here? Does it say something to you?
Well, it says that agility is required from all of us these days. But, I think that what I look for in politics, no matter what party, is people that are willing to have adult conversations and work the intersects on vexing issues. And we need to really require that. We have some real critical issues facing the state. Yeah. They're fixable, but they're going to only be fixed if we're trying to actually work in some form of partnership in the middle.
And Mr. County Executive, you've been in politics and a civil servant for many, 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 many years. There's a lot of talk about civility in politics, lack thereof. Is it possible to turn the hands of time back and have it be a softer, gentler time in politics? Is that even possible anymore? Is that like, don't even think about it?
It's possible. It's possible, but it's going to be hard to accomplish. But, you see so many politicians now who are so far on one side of the spectrum till they see their job as fighting for issues that can never happen.
Oh, boy.
And that's not the way you run a government. That's not the way you run a business.
So much more to say, too. I'm sorry to cut you off. So much more to say about all this. And I know we'd even get to the NCAA Final Four and all that. That's the good news side of all this. But I know we have something. I'll have you guys back. Let's talk about that ahead of time next year.
Sounds good.
Thanks for being here, Bob. Thanks for being here. Dr. Anthony Chang, thank you for being here earlier, and great conversation here. So have a great day. We'll see you again next Sunday for a little bit more Michigan Matters.